Welcome to the Neurological Critical Care Unit at the Montreal Neurological Hospital, part of the McGill University Health Center. For the rest of the video, we will use NCCU instead of Neurological Critical Care Unit. The NCCU gives specialized care for patients with neurological conditions that are life-threatening. After watching this video, you will know what to expect when visiting the NCCU, common equipment used in the NCCU, and how to take part in your loved one's care. In the video, we will talk about the following topics. How do I get to the unit? What are the visiting hours? What can I expect? What is my role? Who is the neurocritical care team? What is the NCCU routine? And how can I take care of myself? This may be a difficult time for you. You may have a lot to think about. You may be very overwhelmed by the amount of information. We hope this video will help you understand what to expect on your first visit to the NCCU. We also have a booklet to go along with this video. You can find it by looking in the description of this video or scanning this QR code. You can also ask the team for it. If this is your first time visiting the NCCU, this is how you get there. Enter the hospital by the main entrance at 3801 University Street. Turn left and take the elevator to the 4th floor. When you arrive on the 4th floor, follow the directions to the NCCU. Once you arrive at the main door of the NCCU, stand behind the yellow line that's on the floor. Please remember to wash your hands when you enter the NCCU and ring the bell. Once you enter the unit, turn left and walk down the hall to the main nursing station. Here, you can ask the unit coordinator which bedside your loved one is in. You can also call the unit at 514-398-1921. The unit coordinator will transfer your call to speak with your loved one's nurse. This is to make sure it's a good time to visit. To protect the privacy and safety of others, we ask that only one visitor is at the bedside at a time. The NCCU has open visiting hours from 8 a.m. to 9 p.m. These times may change or be updated from time to time. It's a good idea to ask what the visiting hours are before your first visit. You cannot visit your loved one outside of visiting hours. Seeing someone in the NCCU can cause you distress. Here are some things you can expect. First, the patient may not look the same as before their admission. There will be many lines, tubes, and unfamiliar equipment at the bedside. All of these are important to help your loved one recover. To help you understand what this is for, let's take a closer look. Some patients may need breathing support or oxygen. Oxygen can be given through a mask, a small tube that goes into the nose, or even a breathing tube. Here, you can see a breathing tube attached to a ventilator. Another line you may see in the hand or arm is an intravenous catheter. This is a small plastic tube that is put in the vein. Some patients may have central lines in their arms or neck area. These are larger than an intravenous catheter and are needed in some cases. These catheters are connected to tubing and special machines called pumps. These machines help give medication or fluid. For example, this white color medication is used for sedation. You may also notice a bag collecting urine. It is connected to a urine catheter, which is a tube draining from the bladder. You will see a monitor beside the bed. This monitor is checking vital signs like heart rate, blood pressure, and oxygen saturation, and will display these numbers on the screen. You may also hear alarms or flashing numbers on the screen. Remember that the alarms are reminders. The nurses are always watching them. Please don't focus on the numbers and alarms. If you have any questions about any of the equipment, ask the nurse or doctor taking care of your loved one. Many loved ones wonder what their role is. One of the most important things you can do is appoint one person to act as the main contact person. This helps the team share information quickly. We will ask you for the name and phone number of the main contact person. We understand that taking care of someone who is sick can look different for everyone. This can depend on your religious, spiritual, ethnic, and cultural background. You can also ask the nurse what you can do to help. You can also help us keep the NCCU space safe by washing your hands before and after touching the patient or anything in the patient's room or bedside, respecting isolation precautions, and protecting other patients' privacy. Who is the NCCU team? The NCCU team is made up of different trained professionals, including doctors, nurses, respiratory therapists, physiotherapists, and other healthcare workers that may be also part of your loved one's care. Sometimes it can be confusing what the role of all these people is. If you're not sure, ask them to identify themselves. There's usually one nurse caring for one or two patients at a time. The nurse will monitor your loved one constantly. The team also monitors patients at the nursing station through a central monitor. At times, your loved one may be alone in the room, but someone is always keeping a close eye on them. The Montreal Neurological Hospital is a teaching hospital. It's common to have more than one doctor take part in your loved one's care. The routine can also be something to get used to when someone's in the NCCU. Every day, the NCCU team meets to talk about each patient's plan of care. This is called daily rounds. These usually happen between 8:30 a.m. until the early afternoon. Usually, the team reviews the patient's status and then plans the goals of care for the day. After rounds, it's a great time to get an update on the patient's status. You may have many questions. Try writing them down on a piece of paper so you don't forget. Some questions you can ask are, how is my loved one doing? What can I do to help? What is the plan for today? When a loved one is sick and in the NCCU, you may think that you must always be at the bedside and may feel very tired. Here are some tips to take care of yourself while your loved one is in the NCCU. Remember, you cannot help anyone if you're tired and become sick. Try to eat for energy, rest, and sleep. When your loved one is ready to go home, you may have a lot to do and to manage. The team is here to help you. Talk to them about your worries and what support you may need. Sometimes you may not know yourself, but speaking with someone can help. Some areas to be aware of in the hospital include the cafeteria on the 3rd floor, the Neuro Patient Resource Center on the 3rd floor in room 354. This is a free library and information service for patients and family members. You can also take a break and visit the Healing Garden on the 1st floor in room 110. It's a great way to get some light and green space any time of the year. Our goal at the NCCU is to give the best care to your loved one. Let us help make your visit a smooth one. For more information, you may go to our website or ask for the booklet.